Dr. Todd Ellerin, who's the Director of Infectious Diseases at South Shore Health. Dr. Ellerin, you were watching that. When you see that, what comes to mind? What comes to your mind?
Well, Ed, I think, it's difficult with pandemic fatigue, right? We have to understand the reality. But what's really important is we have to remember that the virus has not disappeared yet. So people, especially with chronic conditions, the social distancing is still really important. And just because we're going outside, we don't want to be outside with large crowds. And you want to really be careful. Density as far as being around a lot of people and the space and the time, we all want to factor that in. But there are personal decisions right now as far as risk.
So, Dr. Ellerin, is there a safe way to, we've heard it, quarantine, kind of have a bubble of people who all agree to certain practices or something like that?
Yeah, Erica, so I think this is a term we're hearing about. And what that means is that one bubble, for instance, your family who may not be quarantining, comes together with another bubble, but still you try to maintain that distance if possible. Again, it's harder with young kids who really want to be together, but I think that's one of the ways that we can protect each other. Now, these bubbles that are coming together that are still 6 feet apart, you may not be wearing masks, okay? But again, the patients with the most chronic conditions, you want to be careful, and you still want to have that mask available.
Because every step is a new step for us, Doc. The governor's saying today the surge is behind us. What does that mean in terms of cases, in terms of the pressure on hospitals?
Right. So in Massachusetts, we're seeing decreased number of cases. Phase one has opened again, places of worship and, certain, industries, beaches and parks. But to go from phase one to phase two, remember, you're going from start to cautious. So other things are going to be opening. The earliest phase two could open is June 8th. And, we're talking about things like restaurants and places where retailers, lodging, places where there's going to be more people. Now, again, there's going to be restrictions there. To move from phase one to phase two, we have to make sure there's still decreases in cases. There has to be at least no more than 10% positivity, which means the number of testing. We need to make sure we're increasing our testing as well.
Well, while we're on the topic of testing, we've heard in Massachusetts there isn't a plan for universal testing, but is there a move toward testing more asymptomatic people? We're hearing about this?
So, very important. Remember, we're hearing that about 35% of infections are asymptomatic, and we know that a lot of transmissions occur even in patients who are asymptomatic from one person to another. So we have to start testing asymptomatic. So what the Department of Public Health is saying is currently test anyone who's symptomatic, even if they have the mildest of symptoms, but also close contacts. Not only should they be quarantined, but they should be tested as well. Remember, that's anyone who you've spent face-to-face with within 6 feet and 15 minutes. So that's going to increase the number. And anyone who wants to be tested, anyone, even if they're asymptomatic, talk to your provider.
Dr. Ellerin, it's great to chat with you. Thank you so much for your time. Be well.
Take care, guys.
Great to see you.